The term life transforming is a lot of times overused, but when we get to actually do this treatment, all of a sudden they're out of pain. It's unbelievable. Their life is truly transformed.
We're a biological holistic practice. And I don't want to do the same cookie cutter approach that every dentist does, that you just patch things up. We have to really find out what the root cause is.
Hi, I'm Dr. Ben Javid.
I'm Dr. Sean Javid.
It's really important to have a personalized approach for every patient.
Any kind of treatment they're going to need, there's going to be a holistic approach to it. Materials, the way we treat them, everything we do in the office is going to be a holistic basis. And because patients don't want toxicity, there's so much toxicity in the world, we want to make sure at least what we do is going to be healthy for them.
Most holistic dentists will not believe in doing root canals because, as some might know, there's a lot of research now that shows that root canals are leaking bacteria still in the body, whether you have pain or not. Alternately, we would just replace the tooth with a dental implant because at best a root canal is delaying the inevitable where you pull the tooth, and at worst, during that whole time it's still in your body, it's leaking actually toxic bacteria.
And that's just one example that we take, and just that one aspect of root canals or chronic infections that people have, and they have no idea.
These toxins are highly associated with cancer, heart disease, in particular breast cancer.
Instead of antibiotics, we use ozone therapy because antibiotics is not good for your gut. It causes a lot of autoimmune issues. So ozone therapy is the most natural disinfectant we can use. It's been around for 100 years. A lot of holistic medical doctors use it as well. Just immediately, most of these patients come by like, Dr. Sean, I can't tell you, I feel better. I don't know what it is. I don't know if it's psychological. I'm like, no, it's not, because your immune system has been fighting these infections, chronic infections in your body that you had no idea it's been there. And now you're starting to feel better.
It's transformative. It's where we take out the teeth, put implants all in the same surgery, and the next day they come in with teeth. It's really important for us as doctors to listen. I think many times patients are actually surprised when we are sitting with them and listening. You hear very commonly patients saying that, wow, I've never had someone actually sit there and go through my whole experience with me and hear my history. For us, it's the only way to go, but it's usually a surprise.
And once I take care of their needs, the bond is so strong at that point that I have patients that they always tell me, I'm never going to leave you. I've had patients that move to other states, they still come by and see me.
Every patient's needs is different, their health history is different. So what we care about is to make a plan for where they want to be and together, hand in hand, get there.
This is definitely the future. This is the future of dentistry. Oh, at least it's the future for anybody that really cares for patients and want to make sure to do the best thing for the patient. Why are we using toxic materials? We have to see what's toxic, what's biocompatible to the patient, not using things that's going to harm the patient, but at the same time help them.
So with that in mind, when a patient is on the schedule that they tell me, oh, they've had some bad experiences, they're really scared, I'm excited. I'm like, let's go. I'm going to make sure they're going to have a great experience now.